Good morning. This is Minister Thomas DiFilippi Sr. A pre-proposal outline presentation on platelet-rich plasma PRP injection therapy. Concordia University, Chicago. Thomas DiFilippi Sr. ADA student. Student ID number HO103-1987. Research Design Res 7900-1. Dr. Elizabeth Owolabi. The problem statement and research question states the critical claim to a central problem is that the current frontline treatment for knee pain and inflammation has been unsuccessful. Examples were cortisone injection, hyaluronic acid injection, opiate medication, national epidemic problem, and anti-inflammatory medications, Peterson 2018. Therefore, my phenomenological study via taped in-depth interviews will help bring a deeper understanding to the essence of the experience. Excuse me. Plus, viewing of documents to supplement my interviews that will assist in my contents analysis for coding and themes, for coding and as themes emerge. Patent 2002. Consequently, by filling in the gaps and contributing new data to research that statistical data does not scrutinize for researchers, Seidman 2019, so that older adults seeking PRP for a knee as an option to current unsuccessful frontline treatment can make a prudent decision, Dia et al. 2017. My research question is included on that screen, on that slide. How is PRP injection therapy being offered as an alternative to frontline unsuccessful treatment at this time for pain and inflammation? Sub-question, what does the demographic sample show on efficacy of PRP treatment? The next slide for the PowerPoint presentation is theoretical framework. My theoretical theory is constructivism to build on existing knowledge and create new knowledge for the field of gerontology. Piaget, 1896-1980. Gerontology is the study of aging and its effects on people as they grow older. It encompasses comprehension, how aging influences physical, mental, and social aspects of life, as well as how to promote well-being and quality of life in older individuals. Example, aging well and staying active. Excuse me. Gerontology assists us in learning about the changes that transpire as people age and how to support them in leading healthy and fulfilling lives as they grow old. Bing.com. Like dealing with chronic illnesses that cause pain and effective treatment to relieve pain and inflammation. Example, PRP. I've included 10 current peer-reviewed research studies on platelet-rich plasma, article titles in chronological order of evolution. PRP for degenerative cartilage disease, a systematic review of clinical studies. Platelet-rich plasma and cartilage repair. The use of PRP injections in the management of knee osteoarthritis. Efficiency of platelet-rich plasma therapy in knee osteoarthritis does not depend on the level of cartilage damage. Platelet-rich plasma derived growth factor versus hyaluronic acid injection in the individuals with knee osteoarthritis, a one-year random clinical trial. MRI changes on the next slide. MRI changes after platelet-rich plasma injection in knee osteoarthritis, random clinical trial. Platelet-rich plasma as an effective biological therapy in early-stage knee osteoarthritis, one-year follow-up. Clinical efficacy of platelet-rich plasma injection and its association with growth factors in the treatment of mild to moderate knee osteoarthritis, a random double-blind controlled clinical trial as compared with hyaluronic acid. The clinical efficacy of platelet-rich plasma versus conventional drug injection PRP treatment of knee osteoarthritis, a study for a random controlled study. Platelet-rich plasma treatment for talar cartilage repair, a systematic review and metaphysical. Qualitative research design. Definition. Qualitative research focuses on exploring complex phenomena, understanding individual experiences, and generating insight into social or human behavior. It often involves non-numerical data such as interviews, observations, and textual analysis. Key methods that fit for my study are the following. Case study, in-depth analysis for a specific individual group or event. Phenomenology, exploration of lived experiences and perceptions. Example, a case study on how remote work impacts employee well-being by conducting interviews with employees from various industries to gather personal insight and themes. Creswell, 2018. Phenomenological data collection methods, observing participants as they experience the phenomenon, interviewing participants before, during, and after the experience, conducting focus groups where participants experience the phenomenon and discuss it afterward, using methods such as epoch, bracketing, introspection, descriptive analysis, variation, and phenomenological reduction, exploring emerging and incidental techniques like photo elucidation, photo voice, and autoethnographies. Creswell, 2018. Setting and sampling strategy. Clinics in California perform platelet-rich plasma injection therapy. Recruitment at these clinics for older adults 55 plus who already had the treatment. For all eligible older adults responding to a circulated flyer seeking participation. The sample size is N equals 14. Consent will be provided to all qualified participants who meet the requirement. Data collection procedure. Define research question and objective. Identify variables. Choose data. Design data collection. Pilot. Train data collectors. Obtained informed consent. Data collection. Data analysis. Next slide. Thematic analysis. Grounded analysis. Narrative analysis. Content analysis. Discourse analysis. Phenomenology, heuristic analysis. Limitations of study is the next PowerPoint slide. Subjectivity, establishing the reliability and validity of the approaches can be challenging, which makes subjective research difficult. Biased researcher induced bias can influence studies, and this is particularly true with phenomenological research. Sample size, small sample size. Audience studies in phenomenology are typically very small. Accuracy, phenomenology relies on an audience experience, so its accuracy depends on how well participants can express those experiences and feelings. Bing.com search. Ethical considerations. Ethical considerations are integral to conducting rigorous and trustworthy qualitative research. Researchers must engage in continuous reflexivity, be mindful of power dynamics, prioritize participant well-being, and ensure responsible data management and reporting practices. McLeod, et al., 2024. 10 references from my literature review are listed here in chronological order of 10 years or more recent for the study. Those are on here. I want to take note to Dr. Peng, who's on the third slide. It says continued. Dr. Peng and I had a conference up in Northern California on Friday morning. I went up there to find out about how he proceeds with things and all his research that he's been doing, and I'm gonna collaborate a little bit with him further and see if I might need a second injection into my left knee. I've already immersed myself into the treatment as well for PRP study, and so we were discussing that because of my car accident that I had in July 20th. So I am familiar with the procedure, and I did list his his article as well. Also, there was some other continued references that I included in this, and they're all listed there on the PowerPoint slide. I had some trouble with my voice being loaded onto this format with the slides, so I chose to do a YouTube video and talk on the video, and I'm going to put this clip in for YouTube so that you can hear my voice. But my pictures on those slides on the presentation in the grading section. So I hope you understood everything. My name is Minister Thomas DiFilippi Sr. I'll have to figure out how to send a larger PowerPoint clip with audio. As I speak, I'm trying to call tech support at Concordia University Chicago. I have a call into Dr. Owolabi, and I'm also going to be conferring with Dr. John Brophy this morning here on Sunday, March 16th. Thank you very much for listening, and I hope you enjoyed the PowerPoint presentation. And then you can just listen to my voice to try to describe all those slides. Thank you again. Minister Thomas DiFilippi Sr., ADA student, Res 7900-1. Thank you.